COVID-19's link to erectile dysfunction. Hello and welcome back. Today's question is from Alexandria in Lincoln Park. I heard that COVID can cause erectile dysfunction. Is this true or just a bunch of fake news? Hello Alexandria. First of all, I totally understand why you might think this fact is just another scare tactic some anonymous person has put out there. However, there are some researchers who have found connections between the contraction of the disease and erectile dysfunction diagnosis, as well as data pointing to COVID leaving long-lasting results on the way of ED. Infectious disease specialist Dr. Dina Grayson was recently interviewed by NBC and remarked that COVID-19 causes issues in the vasculature. Of course, anything that affects the heart in due course eventually affects erections. So let's break down what erectile dysfunction is so you know what we're talking about. Erectile dysfunction, or ED as it's commonly called, is the condition in which a man cannot get or maintain an erection for the duration of intercourse. To have ED, a man has to experience this 25% of the time or more. This occurs because blood flow to the penis is limited or inhibited in some way. Here are a few other facts about ED. It can be chronic, which is to last a man's lifetime, or temporary and reversible. Reasons for erectile dysfunction can be physiological, psychological, or hormonal. While men over 40, most especially men in their senior years, are more likely to experience it, young men can also suffer from ED. In many cases, lifestyle changes can reverse or greatly improve the symptoms of erectile dysfunction. There are pharmaceutical and surgical interventions available as treatment as well. Now let's get down to the business of how COVID-19 may be related on both sides to erectile dysfunction. A July study out of Italy, which you'll remember was one of the first hot zones, concluded that ED was a risk factor for COVID-19 pneumonia, as well as a likely consequence for survivors. This means that those who suffer from erectile dysfunction before COVID-19 may be more prone to the virus, because erectile dysfunction and pneumonia share many of the same comorbidities like inflammation, stress, anxiety, respiratory issues, hormonal issues, endothelial dysfunction, a condition where the lining of the small arteries constrict, and depression. From what we know about the coronavirus now, the virus is found to attack the inner walls of blood vessels throughout the body, causing vascular blockages. This can cause lasting heart damage from a high number of tiny blood clots happening in the tiny blood vessels in the heart. This blocks arterial blood flow, which is what turns a flaccid penis into an erect one. If there's enough significant damage, it can lead to erectile dysfunction. Of course, remember that more research needs to be done on all aspects of COVID-19, including penis health. If you are concerned about erectile dysfunction, and really shouldn't every man be, I have a few easy tips to incorporate into your life. Number 1. First and foremost, for yourself and your circle, take care. Practice social distancing, responsible meetings, and wear a face mask as recommended by the CDC. Number 2, always wash your hands when you arrive home from being outdoors and use sanitizer. Number 3, stay physically and mentally healthy by engaging with others in safe ways, eating as healthy as possible, and staying active in whatever way you safely can. Number 4, if you are having sex, be sure to do so safely. That means not only using condoms, but caution. Similar to the way we think of being intimate with every person our partner has had sex with, you need to think in the same way about COVID. When you come into contact with them, you come into contact with every person they came into contact with, and so on. Number 5. Finally, take extra care and attention in cleaning your entire reproductive region. Before touching your penis in any way, make sure your hands are exceptionally clean and disinfected. Using warm water, wash your penis thoroughly with a mild cleanser. Be sure to get in all of the folds. Rinse well and air dry. For extra strength, apply a penis health cream. Health professionals recommend Man 1 Man Oil, which is clinically proven mild and safe for skin to tone and fortify the penile skin. This cream contains vital erection boosting nutrients like L-arginine and vitamin C, two known vasodilators, in addition to vitamin A, for antibacterial protection, and shea butter to calm and soften the skin. Man One Men Oil is available now on our website at manonehealth.com and on eBay, Amazon, and the Walmart Marketplace. Thank you for tuning in, and I hope to see you again soon.